Hello, good morning, students. So today we will discuss about the gross anatomy of the heart. So what are the objective of our classes? This is we are dividing this class into two parts. One, I am going to tell about the gross external features and blood supply, and another is internal features. So after the class, we have to know the normal anatomical location, size and shape of the heart, then to enumerate the borders. So we have to know the different names of the borders and the surfaces of the heart. Then to enumerate the parts, that means the borders and surfaces formed by which part of the heart. So we have to know. So to enumerate the parts that forms the different borders and surfaces of the heart. Then to describe about different sulci or groups present on the external surface or outer surface of the heart. Then to describe the landmark to separate the different chambers of the heart from both externally as well as internally. So heart is having four chambers, we know. So how these four chambers externally we can divide. Some landmarks are there, so we have to know those landmarks. Then to describe the internal features or structures of the heart, that means inside the heart, what are the things present, how it is functioning. So we have to know. Then to describe the blood supply and nerve supply of the heart, then to describe the clinical conditions related to the blood supply and the nerve supply of the heart. So these are the objective of the class. Now we go one by one. So come to the anatomy of the heart or the gross structures of the heart. So it is a hollow muscular organ situated in the middle mediastinum of the thoracic cavity. So already you know what is mediastinum. So it is the space between the two lungs, space between the two medial surfaces of the lung. So it is situated in the middle mediastinum of the thoracic cavity. Then it covers, the heart is covered by the pericardium, already it was discussed. It is the shape of the heart. You just see the shape of the heart. It is pyramidal or conic. It is just like a cone, conical or pyramidal, and it is placed obliquely in the heart. It is not in the vertically, but it in the your mediastinum. It is placed obliquely. So it is placing obliquely, not it is vertically, or not it is horizontally. So it is placed obliquely. Obliquely. So your this is the apex. Apex is pointing towards the your left sides and downwards. So it is covered by the pericardium. Shape is pyramidal or conical. Then it is placed obliquely and it lies behind the sternum and the adjoining part of the costal cartilages. So it lies behind the sternum. So if we remove the sternum as well as the left side costal cartilages of the left side, then we will get the heart. Size dimension is around 12 by 9 centimeters. So 12 centimeter, this is from the upper border to the apex, it is your 12 centimeter, and transversely it is 9 centimeter. So length, this is the length and this is the breadth. Then weight is around 300 gram in case of male, and in case of female it is slightly less than the male. So it is around 250 gram. Now come to the what are the things present externally, what are the structures or what are the your landmarks. So it has one apex. So this is the apex, then one base. So opposite to the, as it is a pyramid or cone, so opposite to the apex there is a base. Base we cannot see here because we are looking from the front of the front side or anterior view. So it lies posteriorly, just behind these structures. There we are having the base. Then surfaces, three surfaces. So it is having one base, one apex, one base. Then come to the your surfaces, three surfaces. One is sternocostal. This anterior aspect is called sternocostal because it is related to the sternum as well as costal cartilages. Then this inferior surface, here it is border, but inferior surface or the diaphragmatic surface, because this surface is related to the diaphragm. Then left surface. In this part there will be left surface. So sternocostal, diaphragmatic and left surface. Sometimes base is also said as a posterior surface. So surfaces sternocostal, diaphragmatic, left. So there is no right surface. There is no posterior surface or base. It is same. Then borders. Come to here. This is border. So this is the right border. This is the inferior border. Then this is the left border. And there is the upper border. Upper border is actually, it is obliterated due to the roots of the great vessels. So these vessels are comes out. That is why upper border is not so prominent. It is obliterated. But right border, inferior border, left border. Come to the apex. So apex is conical. It is the conical area. It is formed mainly only by the left ventricle. There is no question of partly right ventricle or left ventricle. So it is only left ventricle. So apex is formed by the left ventricle. This is the apex. So apex is formed by left ventricle, directed downwards, forwards, and to the left. It is directed downwards, forwards, and to slightly to the it is and towards the left side. Then it lies at the level of the fifth intercostal space. If we count the ribs, then we can feel the palpation of the heart or the pulsation of the heart at the level of the fifth intercostal space. At fifth intercostal space, it is right from the your just left to the your lateral to the sternum up to the posterior aspect. So there is some demarcation. So what is that demarcation? It lies at the level of the fifth intercostal space, which is around 9 centimeter away from the midline. So it is fifth intercostal space and your mid-sternal line. So it is your 9 centimeter away from the mid-sternal line, which is slightly medial to the mid-clavicular line. If you draw the mid-clavicular line, it is slightly medial to the mid-clavicular line. It is your surface marking of the apex of the heart. So it lies at the level of the fifth intercostal space, 9 centimeter away from the midline on the left side, which is slightly medial to the mid-clavicular line. Then base, come to the base or posterior surface. Already I have said this base is also known as a posterior surface of the heart. So it forms by the two atria. See, this is the base. Here it is the apex. We are looking from the posterior aspect. So this is our base. Okay. So this base is mainly formed by the left ventricle, left atrium. Part of the right atrium is also forms your base or posterior surface of the heart. So this is the base. So base or posterior surface we can identified by the opening of the 4 pulmonary veins. So these are the 4 pulmonary veins which opens into the left ventricle. So this is the demarcation or this is the identification point of the left atrium. So this is the openings of the 4 pulmonary vein. So it lies, it is directed backwards and to the right, because here you see apex is directed downwards, forwards to the left. And opposite to the apex, we have the base. So base is directed backwards as it is directed forward. So base is directed backwards and towards the right side as apex is pointing towards the left side. So here is the apex and this is the base, suppose. So base is directed backwards and to the right, opposite to the apex. So what is your demarcation or where at which level it lies? So it lies in front of the T5 to T8 in lying down position. Suppose if a person is lying down, then base of the heart, it is just opposite in front of the T5 to T8 or you can say the relation of the base of the heart in which the vertebra is T5 to T8, T5, T6, T7, T8. But when your person is in erect posture, so heart is slightly coming down. So it is your T6 to T9, one vertebra line, your lower level. So T6 to T9 in case of erect posture. Then separated from the vertebra. Now it is in front of the vertebra, but it is not. It is separated. It is separated from the vertebral column. There's base, then the vertebral column. Now this base of the heart and the vertebral column, it is get separated by your oblique sinus. So it is the due to the folding of the pericardium, this is the oblique sinus. Then esophagus and aorta. So these are the main structures which is lying in between the base of the heart and the vertebral column. Okay. So this is our base. Already I have said this is right atrium. Right atrium can be identified by the opening of the superior vena cava and the inferior vena cava, while left atrium can be identified by the opening of the 4 pulmonary veins. This is pulmonary trunk, this is the aorta. Then come to the sternocostal surface or anterior surface. So this is the sternocostal surface or anterior surface. It is formed by your right atrium. See, this is the right atrium, then right ventricle and small part of the left ventricle. So here 3 parts: right atrium, right ventricle and part of the small part of the left ventricle. So it is forming our anterior surface or sternocostal surface. It is separate. It is why it is called sternocostal, because it is related to the sternum as well as the costal cartilages. Then your right atrium and right ventricle. See, these 2 ventricle structures, atrium and ventricles, it is separated by a sulcus. This is the sulcus actually. This is the sulcus. Okay. So this is the right atrium, this is the right ventricle. So right atrium and right ventricle, it is separated by a sulcus, and name of this sulcus is your atrioventricular sulcus. The sulcus which separates the atrium and ventricle is known as the atrioventricular. And it is also known as a coronary sulcus. So your atrioventricular sulcus or atrioventricular groove separates the right atrium from the right ventricle. Or you can say atrium and ventricles are separated because atrium lying at the upper level, ventricle lying at the lower level. So atrium and ventricle is separated by a sulcus or grooves which is known as a coronary sulcus or atrioventricular sulcus. So this is the anterior part of the atrioventricular sulcus or coronary sulcus. Now right ventricle. Now these ventricles, this is right and this is left. So it is also separated. We can see externally. It is also separated by a groove or sulcus which is known as a interventricular groove. So the 2 ventricles get separated by interventricular groove. Now it lies, this is the part of the interventricular groove which lies anteriorly. So it is called anterior interventricular groove. So this is our anterior interventricular groove. This is our coronary sulcus or atrioventricular groove. Atrium and ventricle, atrioventricular or coronary sulcus. Ventricles are separated by interventricular sulcus. This is anterior part of the interventricular sulcus. Posterior part is here in your inferior surface. This is our posterior part of the interventricular groove. Next come to our next surface is diaphragmatic surface or inferior surface. So this is our diaphragmatic surface. See, this part is our diaphragmatic surface or inferior surface. This is our base. So base lying vertically while inferior surface lying obliquely. Okay, base is here, inferior surface is here. So this is our inferior surface. Okay, this is inferior surface. The heart is tilted slightly upwards. That is why we can see the inferior surface, which is related to the diaphragm. That is why it is also known as a diaphragmatic surface. So it is flat and rests on the upper surface of the diaphragm. So it forms by see here, this is our left side because this is left atrium. So this is our left ventricle. So it is formed by your left ventricle. 2/3, left 2/3 is by the left ventricle and right 1/3 by the part of the right ventricle. Okay, when you see the actual heart, then it is very easier to remember or to understand, but in the diagram it is a bit difficult. So here it is as a whole, this is the inferior surface. If we remove this inferior vena cava, then we can see this is the sulcus and this is the inferior surface. So this inferior surface is formed left 2/3 by the left ventricle, right 1/3 by the right ventricle. Okay, so this left ventricle and right ventricle are separated by interventricular sulcus. Now here is the anterior interventricular sulcus, anterior part of the interventricular sulcus, then it goes to the inferior border, then it runs on the inferior surface, which separates the two ventricles, left and right ventricle, and this is called posterior interventricular groove. This is our anterior interventricular groove. It continues on the inferior surface or diaphragmatic surface as a posterior interventricular groove. Okay. Now come to the left surface. So this left surface forms mainly by the left ventricle and part of the left atrium. So mainly by the left ventricle and part of the left, actually atrium means it is the extension, left auricle, not the atrium. So left auricle and the left ventricle forms the left surface of the heart. So it is directed upwards. It is directed upwards, backwards and to the left. So your direction of the left surface is, it is upward, then slightly backward and to the left side. Then come to the right border. How these borders are formed? So this right border, see, it is vertical. Almost it is vertical. So more or less it is vertical and forms by right atrium. There is no question of left atrium, left ventricle, right ventricle. Direct answer is your right border of the heart is formed by the right atrium. So it extends from the, if you see the extension, this is the opening of the superior vena cava. So it extends from the opening of the superior vena cava to the opening of the inferior vena cava. So this is our, this part up from here to here. This is our right border of the heart. So it separates the base from the this is our sternocostal surface. Posteriorly we are having, this is our base. So this is our right border. If we see from the back side or posterior aspect, the heart, we are looking now from the posterior. This is our superior vena cava, this is inferior, and this is our right border. So this right border separates the base of the heart and the sternocostal surface. Okay. So right border, it separates the base of the heart from the sternocostal surface. Clear? This is our right border, this is sternocostal surface, and posteriorly we can see your base of the heart. Then left border of the heart. So left border, it is curved and oblique. It is curved as well as oblique. So it forms mainly by the left ventricle and partly by the left auricle. This is our border also. Surface is extended part, border is a sharp margin. So this margin is called border, but as a whole this area is called surface. Okay. So this left border is formed by the left ventricle and small part of the left auricle. Then it extends from the your auricle, left auricle to the apex, from the left auricle to the apex of the heart. So this is the extension of the left border. So left border separates whom? It is separating the sternocostal surface and the left surface. So left surface of the heart, it is here up to the left, it is sternocostal surface from the right border to the left border. Beyond that left border, we are having the left surface, and beyond to the left surface, we are having the base. So suppose this is the left surface. So this is our left border. Suppose this is the left border. This is the left surface. So posteriorly we are having the base. Okay. So separates the sternocostal surface and the left surface of the heart. Then come to the upper border. So upper border, it is ill-defined because of your origin or the roots of the great vessel. So aorta is arising, pulmonary trunk is arising. So it is ill-defined. It is formed by the right and left atria. If we see here, this is the better here. So right atrium and left atrium. So this is the upper border. So it is not sharp margin, but it is formed by the upper and the border of the right and the left atrium. Then inferior border. Come to this inferior border. So inferior border is almost horizontal. So it extends from the inferior vena cava. It extends from the inferior vena cava to the apex of the heart, and it forms mainly by the right ventricle, and partly by the left ventricle, because apex is formed by the left ventricle. So it is up from this point to this point. This is our inferior border. So inferior border is mainly formed by the right ventricle and small part of the left ventricle. Now it separates whom? This is our anterior surface. Now inferiorly we are having the inferior surface or your diaphragmatic surface. So see here, this is the diaphragmatic surface. So this is our inferior border. This is our apex, so this is our inferior border. Anteriorly we are having the sternocostal surface, and beyond this inferior border we are having the inferior surface or diaphragmatic surface of the heart. So inferior border separates the sternocostal surface from the inferior surface or diaphragmatic surface. Now chamber already you know, that is right atrium, right ventricle, left atrium, left ventricle. Interatrial septum means this is the vertical septum, separates the two atria. Interventricular septum, this is the vertical septum, separates the two ventricles. Then right atrioventricular orifice, that is the communication between the right atrium and the right ventricle. This is called right atrioventricular orifice. This right atrioventricular orifice, it is guarded by three cuffs. Okay, there is this opening is guarded by three cuffs, or you can say three flaps of door. Okay, so this left atrioventricular orifice, that is the connection between the left atrium and the left ventricle, which is again guarded by again your valves having two cuffs. Here valve is three cuffs in the right side, but in the left side valve, your cuffs is two cuffs. Okay, that is the flap actually. Then wall of the heart is made up of the muscle, that is cardiac muscle, which is known as the myocardium. Then it is covered by serous membrane, that is called epicardium, and the inner side it is lined by a lining epithelium, which is called your endocardium, which is your squamous epithelium, simple squamous epithelium, that is endocardium. Now come to the groups or sulcus. Whatever the groups and sulcus we can see over the heart. So this is our heart. So this is our sternocostal surface. Over the sternocostal surface we are having the atrioventricular sulcus, which separates the atrium and the ventricle, and anterior part of the interventricular sulcus, which separates the two ventricles. Now atrioventricular sulcus is also known as a coronary sulcus. So first come to the coronary sulcus. So it starts at the upper part on the sternocostal surface, separating the right atrium and the right ventricle. Then it runs downwards towards the right side. Then it reaches the inferior border. Then it goes backward. Now it comes backward. This is from the posterior. It comes backward and it separating the base or the posterior surface from the inferior surface. So it runs backward and it comes to the left border. Then it again reaches the anterior surface or sternocostal surface. Can you get? So it's just like a neck, but it is obliquely placed, not horizontally. It is obliquely placed. It goes, then it reaches the inferior border, then it goes on the back side or posterior aspect, then it separates the posterior surface or base of the heart from the inferior surface. So this posterior part of the coronary sulcus is separating the base from the inferior surface. Clear? Now what's this coronary sulcus, what structure remains? Because in the sulcus some vessels are present mostly. So this is your right coronary artery. Right coronary. In the right, your anterior aspect of the coronary sulcus, we are having your right coronary artery. So along with this sulcus, this coronary artery reaches the inferior border, then it goes posteriorly, then it reaches this posterior aspect. Up to this much right coronary artery will come. Then it gives a branch to the inferior surface. We will come. So it contains right coronary artery, then along with the coronary artery there is a vein that is called small cardiac vein. Along with right coronary and the anterior aspect we are having a small cardiac vein, which is a venous channels. Then on the posterior aspect, see in the posterior aspect of the coronary sulcus, we are having the coronary sinus, which is this is sinus, this is sulcus, just mind it. This is a sulcus, coronary sulcus or atrioventricular sulcus. But posterior part of the coronary sulcus is having a structures that is our coronary sinus, which is a venous channel, largest venous channel of the heart, which will directly open into the right atrium. Okay. Then along with the coronary sinus, in the posterior part of the coronary sulcus, we are having a circumflex branch of the left coronary. See, this is our left coronary artery. This is the part left coronary artery in the anterior part of the interventricular groove. Now this anterior left coronary artery will give a branch that is called circumflex branch of the left coronary artery. It goes along with the part of the coronary sulcus. This is part of the coronary sulcus. Okay, left side of the coronary sulcus. Now it will come towards the posterior aspect, and along it comes up to this part, So on the posterior part of the coronary sulcus, what structure remain? One is the coronary sinus and one is the left circumflex branch of the your left coronary artery or circumflex branch of the left coronary artery. So in nutshell, just try to remember atrioventricular groove or coronary sulcus, it encircles the heart, separating the atria and ventricles. Then in the anterior aspect, we cannot see, it is not continuous because of the roots of the great vessel, but posteriorly it is a continuous. Okay, so posterior part of the coronary sulcus separating the base of the heart from the diaphragmatic surface. Then on the anterior aspect in the coronary sulcus, we are having your right coronary artery along with small cardiac vein. On the posterior part of the coronary sulcus, we are having the coronary sinus, which is the largest venous channel of the heart, and we are having the left circumflex branch of the left coronary artery. Then come to the interventricular sulcus. This is interventricular sulcus separates the right ventricle and left ventricle. So in between the two ventricles, we are having a groove or sulcus that is called interventricular sulcus. Now, and this is your anterior part of the interventricular sulcus, which lies on the anterior surface or sternocostal surface. Now, what structure laws here? Red one is artery and your blue one is your vein. So it is anterior interventricular artery, branch of left coronary artery. See, this is the left coronary artery and this is the circumflex branch, which goes along with your coronary sulcus on the posterior aspect. Now another branch is running downwards on the anterior surface. This is your anterior interventricular artery because it remains on the anterior part of the interventricular groove. This vein is your great cardiac vein. Artery is coming down, but vein is actually going up because it will have to drain into the coronary sinus. So it is the coronary sinus. It is opening into the coronary sinus. Okay. So anterior part of the interventricular groove, or you can say anterior interventricular sulcus or groove, what structure remains? We are having the artery, that is the anterior interventricular artery of the left coronary artery, and your great cardiac vein. So this is your great cardiac vein. Then this sulcus, anterior interventricular sulcus, it reaches the inferior border, then it runs on the inferior surface or diaphragmatic surface, which separates the left ventricle from the right ventricle. Now posterior interventricular sulcus, it lies on the diaphragmatic surface and lodges the posterior interventricular artery. Posterior interventricular, in this part we are having the artery named as posterior interventricular artery, and one vein is also there. This is called middle cardiac vein. Here it is small cardiac vein on the right coronary sulcus. Here we are having the great cardiac vein on the anterior interventricular groove, and in the posterior interventricular groove we are having another vein, that is middle cardiac vein. Now this meeting point, see here, this is our coronary sulcus, this is our posterior interventricular groove. Now this meeting point is called crux of the heart. So if in the Viva it is asked that what is crux, then our answer is It is the meeting point of posterior interventricular groove, coronary sulcus or atrioventricular groove, and interatrial sulcus. Now this is right atrium, this is left atrium. So in between these two, there is an ill-defined sulcus that is called interatrial sulcus. So all these 1, 2, 3, these three sulcus meet at a point. This is called crux of the heart. Now come to the right atrium, external feature. What are the things present on the right atrium? Right atrium, this right upper chamber, and it forms the right border of the heart, already we know. Then from this up in the upper part, there is an anterior extension, which is called your right auricle. Then sulcus terminalis. This is one of the important landmark. That is the sulcus terminalis. It is a vertical groove. Extends along the right border of this right border of the heart between the superior and inferior vena cava. So sulcus terminalis actually this anterior surface or the sternocostal surface of the right atrium. Then posteriorly we are having the base of the heart. So now these two structures, anterior and the posterior, that is the sternocostal surface and the base of the heart, these are two meeting points. At this meeting point, there is one sulcus that is called sulcus terminalis. Now, what is the importance of this sulcus terminalis? This upper part of the sulcus terminalis, we are having the SA node or sinoatrial node. Now, in the upper externally, if we are having a sulcus, suppose this is the right atrium and this is the your anterior surface of the right atrium. This is anterior and this is the posterior surface or base of the heart. Now, externally we can see one sulcus. Then what will happen internally? Internally there is a one elevation. So internally or inside the right atrium, just opposite to the sulcus terminalis, we can see one elevation that is called crista terminalis. So crista terminalis, it is the corresponding internal part of the sulcus terminalis. Can you get my point? Suppose this is an external surface. This is your anterior aspect of the right atrium. This is posterior aspect of the right atrium. Now at the anterior and posterior, at this junction of the anterior part and posterior part of the right atrium, now there is a one groove. This is a groove. Externally we can see. Now what will happen internally? You see internally there is a one elevation and that elevation is called crista terminalis. Now right atrium, it is your quadrilateral in shape. It receives opening of the superior vena cava, which is having no valve at the upper posterior portion. Then opening of the inferior vena cava and the coronary sinus at the lower posterior portion. Opening of the coronary sinus, it receives blood from the most of the means all the cardiac vein. Almost all the cardiac veins of the heart will open into the coronary sinus. And finally, coronary sinus will open into the right atrium. Now, coronary sinus opens medial to the opening of the inferior. Now, in the your inferior aspect of the right atrium, we are having two openings. One opening is your inferior vena cava, one opening is our coronary sinus. Now, these two openings, out of this, what will happen? Coronary sinus opens medial to the opening of the inferior vena. Okay? So, it lies medially to the opening of the inferior vena cava. So, here this is the internal aspect. This is our crista. This is your, we are cutting. We have cut your right atrium. And this is our anterior surface. Now, at the junction of the atrium and ventricle, we cut here. Now, this anterior aspect of the right atrium, we just open it, just like a door. Then what will happen? We can see the crista terminalis, which is extending from the opening of the superior vena cava to the opening of the inferior vena cava. This is our anterior wall of the right atrium. This is what we have seen here. Actually, this is our interatrial septum. Okay? So, interatrial septum forms the posterior wall of the right atrium. Now, this is the opening of the superior vena cava. Now, this is the opening of the inferior vena cava. and this is the opening of the coronary sinus, which lies slightly medially. So this is the openings, and these two opening is guarded by vein, by a valve. So valve of the inferior vena cava, and this is the valve of the coronary sinus. I have mixed here external fissure and internal fissure. Okay, actually class is on only external fissure, but I think that if we can go through the external and internal of each part, then it will be more easier to understand. Huh? So internal structures or internal fissures of right atrium. So interior of the right atrium is divided into two parts by crista terminalis. See here, if suppose if we close the door, okay, this is the opening of, actually we have cut here. Now if we just close it or intake right atrium, then what will happen? This is our interior of the right atrium. So this is your rough. Have you seen? These are some ridges are there, that is why this is rough, and this is your smooth part. Now smooth posterior part, this is our posterior aspect, which is here formed by the interventricular septum, interatrial septum. So this smooth part, it is your derived from, it is also known as the sinus venorum, which is derived from right horn of the sinus venosus. So I already developed development, you know. So smooth posterior part, which is known as the sinus venorum, this is smooth posterior part, which is known as the sinus venorum, derived from the right horn of the sinus venosus. Then all veins except the anterior cardiac vein opens into this part. See here, all the veins are open except anterior cardiac vein. Then rough anterior part, this is our anterior part, we have cut here and just open it. So rough anterior part, it is your atrium proper, which is derived from primitive atrium. Then present transverse ridges, this anterior aspect, why it is rough? Due to the presence of the ridges, and these ridges are known as a musculi pectinati or pectinate muscle. Now this pectinate muscle, where from these are arising? See here, this is the crista terminalis, and from this crista terminalis these muscle fibers are arising. So these from the crista terminalis muscle fibers are arising, which forms the ridge, and due to this ridge there is a roughness, and it is derived from the atrium proper. Then septal wall of the right atrium or interatrial septum, which is derived from the septum primum and septum secundum. Already you know, this is the posterior wall of the right atrium, which is formed by the interatrial septum, which is derived from the your septum primum and septum secundum. Now there is a fossa ovalis, which is an oval depression in the septum just above the orifice of the inferior vena. So this is the orifice of the inferior vena cava. Just above the opening of the inferior vena cava, there is a depression, and this depression is called known as a fossa ovalis. Just above the fossa ovalis, there is a your margin, and this margin is called limbus fossa ovalis. Okay. Then openings into the right atrium, already I have said superior vena cava, no valve, inferior vena cava guarded by semilunar valve, which is known as a eustachian valve. Then opening of the coronary sinus guarded by a valve, which is known as a Thebesian valve. Then right atrioventricular opening lies anterior to the opening of the inferior vena cava. Then it is guarded by tricuspid, that is the connection between atrium and ventricle. Then all your apart from the coronary sinus, all veins are open into the coronary sinus, and coronary sinus opens into the right atrium. But there are so many small veins which opens into the your chambers of the heart, and this is called Thebesian veins. So Thebesian veins also opens into the right atrium without opening into the coronary sinus. Then come to the right ventricle. So this is our right ventricle. See here from the anterior aspect. So it is almost triangular chamber. Then it communicates with the right atrium through the right atrium, and right ventricle is communicated. Then this opening is opening here we cannot see. This opening is called atrioventricular opening. Then pulmonary trunks goes from the right atrium. Okay, right ventricle. And there is a opening is guarded by a valve which is called your pulmonary valve, and that orifice is called pulmonary orifice. That is from the right ventricle. There are two opening. One opening from communicate through the right atrium, and one opening it goes out. That is from the right ventricle blood goes out through the pulmonary trunk, and that opening is guarded by a valve which is called pulmonary valve, and that opening is called orifice, pulmonary orifice. Then its right ventricle forms the most part of the sternocostal surface and part of the diaphragmatic surface. Right 1/3 of the diaphragmatic surface. Then right atrium and right ventricle is separated by your anterior part of the coronary sulcus, while this and your left ventricle and right ventricle is separated by your atrioventricular groove, anteriorly anterior interventricular groove, or inferiorly this is our posterior interventricular groove. Now come to the internal fissures of the right ventricle. So wall of the right ventricle is thinner than the left ventricle because left ventricle will have to more contract, function is more, so in comparison to the right ventricle. So wall of the right ventricle is thinner, at your ratio is 1:3. If 1 centimeter thickness of the right ventricular wall, then left ventricular thickness, wall thickness is around 3 centimeter. So interior of the right ventricle again consists of two parts, which is separated by supraventricular crest. So this is our interior. We have cut the anterior aspect, then we can see this, and this is our supraventricular crest. Now above this supraventricular crest, this is your smooth part, and below the supraventricular crest, this is your rough part. See here, then lower rough inflowing part and upper smooth outflowing part. Here blood is going, when the right ventricle is contracting, blood is going out through the pulmonary orifice or pulmonary trunk. So this is upper smooth part. While lower part below the supraventricular crest, this is your rough part. Okay. So large area, your rough inflowing part, there is large area lies below the supraventricular crest, developed from the primitive ventricle. When there is a rough area, they are developed from the actual heart tube. And where there is a smooth part of the smooth part, they are actually by reabsorption of the other structure. See here, I will show. So it develops from the primitive ventricle. Then roughness. Why this roughness is present? Due to the muscular ridges. These are the muscular ridges. Due to this muscular ridges, this part is inferior part or inflowing part is rough. Inflowing part, why it is called inflowing? Because this is the right atrium, this is the right ventricle. So this is the communication, right atrioventricular orifice, and this white part is our nothing but these are the valve, semilunar valve. Okay, tricuspid valve. Then upper smooth part, that is called outflowing part, it is known as infundibulum. It is smooth and conical and give rise to the pulmonary trunk. See here, this is give rise to ultimately pulmonary trunk. So it is small in size because your smooth part is small, area is small than the rough part, and your lie above the supraventricular crest, and it is developing from the bulbus cordis, not the primitive ventricle. Primitive ventricle part, it is rough. It is your bulbus cordis, which is upper part, outflowing part, smooth part. So come to the trabeculae carni. In this, you're inside the right ventricle. These are muscular projection. So whatever we have seen here, rough part, due to the muscular ridges, and these muscular ridges are known as a trabeculae carni. Here in case of atrium, I have said these are musculi pectinati. In the atrium, these are muscular ridges, these are known as a musculi pectinati or pectinate muscles in the atrium. But in the ventricle, these are known as a trabeculae carni of the right ventricle. So these are muscular projection responsible for sponge-like appearance of the right ventricle. Then types of trabeculae carni or muscular ridges. There are three types. Ridges, fixed elevation, that means from the wall it goes up. This is your ridge. Where there is a bridge, that means at one point it starts and at the other point it ends. So this is your bridge. That means it is bridging. Only one ends are fixed. Then your pillars. Pillars are base. Here ridge is fixed elevation. Then bridges, only one ends are fixed and central part is your free. actually not one ends, both the ends. Two ends are fixed and one central part is free. While pillar is base is fixed to the ventricular wall, apex is free. Ridge and pillar almost same, but height of the pillar is more than the ridge. Okay. See here, these are your pillar. These are pillar, and these are bridge. These are bridging. See here, one point here and one point here. So it is central part. It is, and these are your elevation, ridge. So there are three types of trabeculicarny: ridge, bridge, pillar. Pillar is your height is more, while ridge height is very less. Then bridge central part is free, while both the parts ends are attached to the ventricular wall. Now, in the ventricle, we are having the papillary muscle. Now, papillary muscles is nothing actually. These muscle, what is present inside the heart, this is called trabeculicarny, and we call it, there are three types of trabeculicarny: ridge, bridge, pillar. Now, we give a name to these pillar muscles as your papillary muscle. Okay. So, papillary muscle, it is a pillar type of trabeculicarny. What is trabeculicarny? These are muscular projection. Okay, so don't get confused. Trabeculicarny is the muscular projection inside the ventricle. Now this trabeculicarny are three types: ridge, bridge, pillar. Now this pillar type of papillary trabeculicarny, we give a name, that is pillar type of trabecular, that is called papillary muscles. It is projected into the ventricular, so it is projected into the ventricular cavity. Base is attached to the ventricular wall. So base is attached to the ventricular wall and apex is pointing towards your cavity. Now these apexes are, see here, apexes are connected to your fibrous cord-like structure which is attached to your cuffs. These cuffs are there, and these cuffs, from the cuffs some fibrous cords are going, and these apex of the papillary muscle, it is attached to those cuffs, those apex of the papillary muscle. So these are fibrous cord which are arising from, suppose this is cuffs, this is one cuffs, at the margin of the cuffs some thread-like structures are going, and this thread-like structure, where it is attached? It is attached to the papillary muscle, apex of the papillary muscle. Now what will happen? When this papillary muscle will contract, papillary muscle is contracting, so it will pull your cord downward. So ultimately this cuffs will open. Now when this your muscle will get relaxed, it will go, these cords will get relaxed and it goes and up, and ultimately cuffs will close. So what will happen when there is a ventricular contraction? When there is a ventricular contraction, it goes upward. It goes upward. So there is a relaxation. As there is a relaxation, cuffs close. So their blood cannot enter from the ventricle into the right atrium. Now when these ventricles get relaxed, then what will happen? Ultimately it goes down. Ventricular wall goes down means ultimately this cord will pull downward. So that is your opening of the cuffs, opening of your valve. So blood can enter from the atrium to the ventricle. That is why during the diastolic phase, blood can come from the right atrium to the right ventricle. But during the contraction, when there is a systolic phase, heart will contract, means it goes up. So your thread, this tension in the thread releases, and ultimately your atrioventricular valve get closed. Can you get my point? So this is the fundamental things in your that is called heart sound. Now this cord-like structure, we are giving one name, that is called chorda tendoni. These cord-like structure we give a name, that is called chorda tendoni. So these are muscular ridges. These are muscular ridges. That is your trabeculicarny, and there are three types of trabeculicarny: ridge, bridge, pillar. And this pillar we give a name, that is a papillary muscle. Then it is apex. From the apex some cord-like structure goes and it attaches to the margin of the cuffs, which is known as a chorda tendoni. Then there are three papillary. Now again we are having three papillary muscles. Okay. According to their site of origin, we are giving the name. So anterior. Suppose we are having an anterior wall of the right ventricle, posterior wall of the right ventricle, and one septal wall. This posterior is also known as the inferior. Now, if it is coming from the anterior wall, if it is coming from the papillary muscle, which is coming from the anterior wall, we give a name that is anterior papillary muscle. If it is coming from the inferior surface or posterior surface, then we give a name that is your inferior papillary muscle or posterior papillary muscle. And if it is coming from the septal, that is interatrial septum, then we give a name that is the septal type of papillary muscle. So anterior papillary muscle is the largest size papillary muscle, while posterior or inferior one, it is smallest size papillary muscle. And septal, here it is what happens when it is coming from the septal, this apex is divided into 2-3 nipples. So suppose in case of anterior and posterior apex, there is a one apex. Now in case of septal, what will happen? They will divide, this apex will divide into 2-3 nipples. Okay, that is how we can differentiate which one is septal, which one is anterior or posterior. Clear? Now there is a moderator vein or septomarginal trabeculi. This is a thick muscular ridge. There is a thick muscular which is extending from the ventricular septum to the base of the anterior papillary muscle. Suppose this is our anterior papillary muscles. This is anterior papillary muscle. Now it is extending from the ventricular septum. This is our interventricular, because this is right ventricle, this is left ventricle. So this is our interventricular septum. Now it is extending from the ventricular septum. Here it is the ventricular septum. So it is extending from the ventricular septum to the anterior papillary muscle. Okay. This is a muscular ridge extending from your interventricular septum to the anterior base of the anterior papillary. This is our anterior papillary muscle. So to the base of the anterior papillary muscle. And this is known as a septomarginal trabeculi or moderator vein, which conveys the right branch of the AV bundle. Because AV bundle is divided into, that is our conducting system, into right branch, left branch. So right branch will come along with this your muscular ridge, which is extending from the interventricular septum to the base of the anterior papillary muscle. So this is our moderator vein. So it prevents the over distension of right ventricle. Okay, in the next class we will continue. Okay, thank you.
Thank you, sir.